I'm going to introduce myself and then I'll hand you over to Thomas. So my name is Shanara Abdin. I'm the service lead here in behavioural science. So the role that we're talking about today sits within my team. So if I just pass you over to Thomas.
Hi everyone, my name is Thomas Harwood. I am the head of office for the Director of Public Health. My role encompasses lots of different things. One of those is workforce development, hence my attendance on this call. Nice to meet you all.
Thanks, Thomas. As I said, for those who are just joining, and we are recording the session, so do feel free to turn your cameras off if you wish. If you've got any questions, please use the chat facility and we will come back and ask you again if you have any questions. So as I said, my name is Shanara and this role that we're going to talk about today sits within my team. So just to give you a bit of an overview of what we're going to talk about today, it's an overview of the council and how we work here and how that links in with local authority public health. So I do know a number of you on the call have come from different kind of domains and academic or NHS, voluntary sector, etc. So just to kind of talk about how public health works here. And then we will talk about the role itself, what that means, what does a role entail, how it sits within the team and public health, and then also any details of how you can apply and what we also as a council offer all of our employees, which we talk about as well. So firstly, why Birmingham? Why Birmingham City Council? So how the council works is it's the local government body which is responsible for the governance of the entire Birmingham population and the city of Birmingham. So our work is very much trying to make a difference in every single thing that we do with our citizens, residents of the city. And what we do matters not just for today, so it's not just immediate kind of making a difference, it's on the long term, kind of generations to come, and those individuals who, either coming in here university, growing, living throughout their entire lives in Birmingham. So it's literally for everyone who lives in the city. We are actually the youngest city in Europe, with about 40% of our population under the age of 25. That is partly due to the universities that we have across the city as well. And what that means for us is our youthfulness provides relentless spirit and ambition to ensure that the city always has new achievements and breakthrough, and also that we provide our citizens with the job opportunities that we're going to talk about today. So that is a bit of a flavour about Birmingham and how kind of bit of an introduction really. How this sits within the public health division. So I'm not sure if any of you are coming from a background in local authority or background in public health or NHS, but we are actually Europe's largest local authority. So the public health division, so the public health department that we have here, aims to be world-class specialist public health. So all of our colleagues, we have, and I'm sure Thomas will correct me if I'm wrong here, about 125, I think, in the division.
You're only a couple off, yeah. 127 posts in the team.
Missed off 2 people. So yeah, we are, as you can imagine, a very large division. We do have a range of skills, which I'll talk about in a bit, and how the actual division works. But we are all very much evidence-based, and we do try to use that through a population health approach. Thomas.
Just like to come in there. So as every authority and most people working in health and social care, we pre-COVID sat at 39 people. We are now more than ever, COVID highlighted this to us, where we work in a prevention way. Public health has always done that, but the rest of the council has seen the benefit to that. So much so the council has got now an early intervention and prevention directorate, which we don't sit in, which might sound a bit strange at the moment, but we recognise that early intervention is the way forward. It's to stop people entering the system and creating really good health behaviours, and hence why Shanara's team have been in post now just over a year.
Nearly a year, in February. So yeah, we are a brand new team in behavioural science here, and just talking about public health. As I said, we do focus on population health, so we don't actually do one-to-one work. However, the work that we do does link in with every single individual who works in the city in Birmingham. So public health is all about helping people to stay healthy and protecting them to live a healthier and longer life and just stay healthy throughout their entire lifetime. So public health has actually become a statutory function of the council since 2013, and that was because public health initially was in the NHS, and then in 2013, through the Health and Social Care Act, all public health departments were brought into individual local authorities. So as public health, and this is national public health, not just to Birmingham, but public health looks at health protection, health improvement, and healthcare, public health as three of their main domains. So the kind of image that you see on the screen, if anyone's from a public health background, that may be quite familiar, but it just gives you an idea of how this works in terms of the wider determinants of health. So what that means is that public health links with everything. So whether it's your social background, whether it's your work environment, whether it's your education. So what we do in public health is link to all that, and we don't just look at individuals through one system approach. It's through across the board. So many of you here, I'm sure you're all here because you either have an interest or background in behavioural science. So why is behavioural science important? So as Thomas rightly said, we are a new team. We started in February this year, so it will nearly be a year. We are a very small team within behavioural science, but what we try to do is improve the health and well-being of our residents and our citizens through supporting them with healthy behaviours. So the behaviours that you can see on your screen are quite generic, so healthy eating, not smoking, physically active, and then limiting alcohol intake. And as we all are well aware, these have lower risks to like heart disease, stroke, cancer, dementia, etc. So we are very much behaviour led. So these are the sort of very generic behaviours that we do, but we also focus on other behaviours that could also be, environmental health, like trying to get people to pay their bills, for example, on time is another behaviour change example. Attending your GP appointment, for example, that's linked to behaviour change. So behaviour change is very broad, but I just wanted to give you a bit of a flavour of how it links. The data is a bit, a fair bit out of date from what you can see on your screen. This is 2018, but some of the healthy eating obviously is a bit more recent. So like I said, we do try to work across the board. So before we talk a bit more about the role, I just wanted to give you guys a bit of an overview, and Thomas, do come in here if I do miss anything. This is our divisional structure and how it sits. So every public health department across the country has a director of public health. That is a legal statutory duty, and they sit within the corporate leadership teams. So for us, our director of public health is Justin Varney, Dr. Justin Varney, and that splits within six, so I had to count them myself, six subdivisions. So we have deputy director, we have healthy behaviours in communities, children, adults and older people, health protection and environmental public health, and then knowledge and evidence. We also have a public health business support office, press, PR and comms, so that's Thomas's world, and behavioural science. So those three, as you can see at the bottom of the screen, sit within the entire, all the domains we work across. Now, we sit within the deputy director subdivision. So as I said, we all work across all four of the domains that you can see on the screen, but we formally sit within our deputy director, who's Joe Tonkin. So just a bit of breakdown, about career progression within the division. There's a huge emphasis on continued professional development here. We have a lot of support, and if I'm honest with you, I think this is probably the plan that we've got is probably one of the best. We do get a lot of feedback from colleagues and students. We have a lot of student placements here to support them, just get an idea of what public health is it a career that they want to go down, and I mean, I've only been here at the start of the year, and a lot of students that I've worked with have managed to, come in either as a graduate or on student placement or etc., and manage to secure, a permanent role if they wish. So how it typically works is the roles that you can see on your right-hand side are the roles that we have, and how it links with practitioner, senior practitioner and specialist registration is with the UK PHR, so that's the UK Public Health Register, who have these formal links, formal routes to link in with your public health career. So if I start from the bottom going up, within Birmingham, within our public health division, we have public health support officers and public health graduates. Then we have the public health officers, and we then have senior officers, service leads, and then above the service leads is where you get your specialist registration. So they typically are your consultants in public health who have a formal qualification. We have assistant directors and the director of public health. Within Birmingham, we also have public health portfolio leads, which isn't a common practice within many local authorities. This is something quite new, but this is a training post. So what that post means is those individuals who are in that post, they will be working themselves up to become a consultant in public health. So the role that we are talking about today is actually a public health officer role. So this role will be line managed by the public health senior officer in behavioural science, and then above them is myself as a service lead. Is there anything more that you'd like to add, Thomas, before I move on?
Yeah, so what I would say is training is fundamentally at the center of our core. When people join our team, they do something which is called a skills and knowledge audit, and off the back of that, what we do is we audit the entire team. And what we do in my team is we have somebody that will work towards plugging the gaps within our knowledge and our experience across the division. So everything we do is really well planned and executed. So when we do any lunch and learns, it will be mapped against the public health skills framework. When we have our away days, which we have 4 a year, where we bring the team together, any workshops, training that we do will be mapped against public health skills framework as well. And each person that works in the team is not at full capacity. They have capacity to be able to self-learn, to pick up extra projects, to do other things to again help enhance their knowledge and their skills. So we have something called a development framework, and there are a number of projects that people can work on. Again, you have to get authorization, but again, they are mapped against the public health skills framework, and you'll be able to tick those competencies off. And what we also get at the support officer and officer level is people not having that management experience to be able to move on to the next part. This is a shameless plug from me, so apologies, Shannara, right here, right now, but we have a great student program. Last year, we had over 70 students join us across the year, and typically our support officers and our officer roles would manage those with support from the likes of Shannara and myself, because we have a whole program that sits around them to enable them to develop those managerial skills in terms of managing people as well.
Thanks, Thomas. So yes, we do have an ample amount of support. We also wider through corporate, through the council, we do have employee support. So as Thomas rightly said, we have supervision, access to a workplace coach or a mentor. Within this role, there is links to behaviour change, and if someone wants to actually work towards becoming a qualified health psychologist, I do work really closely with trainees, and I have links nationally with the British Psychological Society and various other networks, which I can always tap you into if there's something that you want to access. We don't fund stage 2 training, so we don't fund qualification in health psychology. However, we do offer that support, that mentor, that coaching. We're more than happy to read any applications over if that's something that you want to, go down the academic route, for example, as well. So no matter where you are in terms of your job role, this support is available to us all as employee support. We also have 8 staff networks, which is really important for wellbeing, and colleagues are more than welcome to join more than one. There's no limit on how many staff networks they can join, and it's just really helpful. And you get to meet colleagues who aren't just in public health, across the council, and they do some fab kind of events and all sorts, and it's just great. It's just like a really nice community feeling. So that's something that we do offer as well. Thomas?
On top of what Shannara said in terms of those groups, yes, they are there to support people that want to join those groups and their allies, but also helps inform the council, and it helps shape policy. It helps enforce different things. But also there is another one that's not on there, but we do have a it's escaped me now. Early careers. Yeah, so anybody, depending on what level you come in at, whether you are the CEO, you are a support officer, whatever you're doing, we have something called an early careers network. And what that does is it connects people that have just joined the organisation together to enable them to build their networks, to support each other, and helps the organisation understand what it's like to be a person early on in their career with BCC, Birmingham City Council, not early on in their career. So it's not like a graduate network or anything else like that. And internally within public health, we do have a graduate network as well, but that's not council wide. Public health has the biggest amount of graduates in the council as well, which does help keep us quite a young division. We've managed to keep hold of most of our graduates over the years, but it's a very diverse place to work because of the kind of graduates and the people that we attract to work here. It's a very open, very authentic place where people can be their selves. But I digress now. But that early careers network is really, really important.
Thanks, Thomas. Yes, and what's not on the slide as well, in terms of employee support, we offer a lot of support around wellbeing. We have like the employee assistance program. There's a lot of new ways to work as well. It's just a lot of support that we just could not put all on one slide really, but just to give you a bit of flavour of what it's like working here. So I'm just going to move on to talk about the job description itself. So the job is Public Health Officer in Behavioural Science. And what I'm going to do actually, I'll go back a slide. So I'll just talk about the role context first, and then I'll go back a slide, talk about the job description. So the salary, it's a permanent role. The location is in Birmingham. So the role is very much talking to citizens and residents and organisations, very much engagement-led, research-led. So we do expect this post holder to actually come out into Birmingham, have those discussions face to face. Also, we have a requirement where we come into the office as a minimum every Wednesday. So it's just really nice coming into the office, talking to colleagues. So that's why it's a hybrid, which is why we cannot offer 100% remote. I do appreciate, I've had a number of questions around this, but it is hybrid, flexible working indeed, but there is expectation where you do come into the office and you do go out into Birmingham based on the work that we're going to work on. So as I said, the role involves very much the evidence base. So focus groups, interviews, community engagement, and how we work. Because if you remember at the start, we showed all the subdivisions. The behavioural science team works across the entire division. So we do some work with adults team, we do some work with comms, we do some work with knowledge team. We do matrix working, so we work across the board. As behavioural science is quite new here, we do have this agenda in the team where we're trying to drive forward what behavioural science is. And we do that by having conversations, by training staff or colleagues or, internal partners, external partners. We also very much have a focus on designing and developing interventions. So as behavioural science experts, we do a lot of evidence-based, and then that links to implementing interventions. And then using your knowledge of behaviour change and health psychology. So a key part of this role is applying behaviour change to public health. So if I go back one, I know it's quite small on the screen, but just to give you a bit of snippet. So this is the job description, and then the key responsibilities are on the right hand side, and it echoes pretty much what I've just said really, and how it links in. But we do not accept CVs. That's something that we don't accept, so we do need a supporting statement which links in to the criteria that you can see on the job description. Thomas?
Just to highlight there, when you look at the person spec and the job description gives you a real overview of kind of what the role is. When you look at the person specification, and I don't mean to teach people what they already know, but what we tend to find when people are writing their person spec, well, their application, as we call it, modeled against their person spec, then you need to pay close attention to the method of assessment, and it's quite clear on the person spec. We get lots of half a pages, a page that really doesn't describe or bring to life the method of assessment. So if it is AF, that's the application form. If it's I, P or T, that could be the interview, presentation or test. If for instance, something is an AF point, it won't be marked to get at interview stage, and vice versa. So if you put anything in there that is, say, for I wish my eyesight was that good, or I could read the third point down, which is the I point, it won't be marked. Just to put it into context, when we do our selection process, and I'm sorry if you've got this on a slide later on, that when we put the job out to advert, we have a panel that represents the city of Birmingham as best as possible. We try to make it as diverse as possible. That panel separately will read every single person's submission. They will score it based on our matrix. We come together and we moderate to make sure it's fair and it's robust. That panel stays with the entire process throughout. They will do the interview, they will do the moderation of the interview, and they will make sure that person gets onboarded and support Shannara as the recruiting manager, as so do I, because I'm part of the recruitment package here for the service leads. So it's really important to understand it's not a computer, there's no AI, there is nothing fancy about our recruitment process. It is all fundamentally down to that supporting statement, and I labour the fact because we do get CVs, we don't read them. If people submit any work, we will read every single word that is written, but we will cross-reference it against the person spec.
Thanks, Thomas. And just, oh, sorry, Thomas, go on.
We'll come to any questions at the end, so I can see people putting questions in. Please continue to do that. We'll come to them at the end.
Thanks, Thomas. What I was just going to add to that is also, because this is behaviour change, do not assume that the panel or anyone who's reading your application know any acronyms. I would always recommend to spell them out. You know, if you're using any models, for example, or making any reference, do just spell them out, because the panel may not always have experience in the area. As Thomas rightly said, it's representative of Birmingham. So just to talk about the supporting statement a little bit further, just touching up on what Thomas has just said, it is literally to show us, to show whoever is reading your supporting statement how you meet the requirements on the person specification. It's your opportunity to provide any examples of what you've done, how you've applied behaviour change within public health or behaviour change within health and wellbeing. Like I said, the shortlisted panel may not have a background, in health. They'll have a background in public health, they just won't have a background in behaviour change as such. And just try and answer each essential criteria set out in the application form. So set it out as clearly as possible, so they know what your skills are, what your qualifications are, what your experience is. It just makes it a lot easier for anyone who's reading. And I know we've probably laboured this point a lot, but yes, we do not accept CVs. Sorry, Thomas, go on.
In public health, we get a lot of applications, speculative applications. For instance, our graduate applications, we get upwards of 180, 190 applications come through for each one of those. And yes, we do read each and every one of those. We don't discard them under certain lengths. We don't discard them for any reason. We would read every single one of them. Typically, our most popular roles are the support officers, the officer roles. People see it as an entry into public health, into working for the largest local authority in Northern Europe, and we can be very popular. So it's not about standing out from the crowd in terms of how much you write. It is about what you write. It needs to be concise. It needs to fit the person specification point. But there has to be that element, and a word that we've been using quite a lot recently is the so what. So yes, you can do this, but what does that mean? How have you done it? What is what is the outcome been? And is there any kind of reflection on that as well? It's a short paragraph about each point, really. You could find an example that covers 2 or 3 points. If you do that, make it clear which points you are talking about. Generally, the best way I have seen in writing a person specification application form, just get the person spec, take all of the AF points out, write them on a piece of paper, if you're a bit like me, or on a computer, and then write your example underneath, and then start to put the meat onto the bone in terms of what we've just talked about. What is the so what around your experience and your knowledge and your skill? And what you will find is it will naturally start to lengthen, and then you just look at the conciseness of the example and the points you're looking at, and it has to be obvious. Make it obvious. Put the words that are in the person spec point in bold if you're doing it over a couple of one example over a couple of points, or write it paragraph by paragraph.
Right. Thank you, Thomas. Okay, fab. So filling in your application. So the application is on WM Jobs. So that's where all the West Midlands local authorities, all of their jobs are held. That is the only place where you can apply for a role within the public health team here. And as I said, this role has a focus on behavioural science, so knowledge in this area is key. What we've done is we've split into, Thomas has pretty much covered all this, but definitely yes, and then a maybe not. So, for example, checking the eligibility criteria, make sure all the boxes are complete. Be guided by the person specification, your skills in and around, in this case, public health and behavioural science. Ensure you provide examples. And then, as Thomas had mentioned earlier, go through, the last column where it says AF. Make sure you make reference to that, because that is all the stuff that we're going to look at. Take your time, so do not rush in submitting an application. We have actually extended the deadline to the job to this Sunday, I believe, yes, to the 3rd of December. So you do have an extra few days to apply. And as I said, ensure it is, by the deadline, so late applications cannot be submitted. Sorry. And as Thomas has rightly said, yeah, examples don't need to be your workplace. So, there can be any research, for example, that you've done during any of your studying, or, if you did any volunteering work, for example, please add that. It does not have to be paid experience. It can be any experience that you have, whether that's even, any research or any training, for example, that you've done for your studies, etc. What we don't recommend is don't skip any boxes. So make sure you go through it all completely, and do what Thomas said. If it works for you, go through each of the ones individually, take them out bold, make sure you haven't missed anything. We do get this quite a lot, where we do get generic kind of supporting statements. So we would recommend not to do that. So make sure, you know, the application that you're putting in does make reference to public health, does make reference to behavioural science, for example. Don't attach certificates. We don't need them. We won't see them. We don't need them. The only thing we need in order for you to be shortlisted for interviewing is your personal statement. We don't read your CV. So yeah.
And certificates will be taken for the successful candidate at point of appointment, and we need to upload those into the system, and that's when that will come.
Thanks, Thomas. And please don't assume anything about the role. So, you know, ask those questions. Our email address is on the advert if it's something unsure, but just, you know, stick to what we've provided, stick to the person specification.
And just to add to that, we won't assume because we see a job title or that we won't interpret what that means. If it's not written, it's not marked. Nothing will be assumed. Whatever is in writing is what we go by.
Thanks, Thomas. Yeah. So I'm sure many of you are probably familiar with this, but this is where you go to apply. So it's wmjobs.co.uk, and if you just type in public health and search or behavioural science, this role will come up. As I said, the deadline has been extended to this Sunday, so you've got a few extra days to get an application in if you haven't already. So I will take questions. We'll take questions in the end, but in terms of our social media presence, we do have what we call Bolder Healthier, and that is to support our engagement with citizens and partners. We have what we call the Healthy Brum campaign and branding. This sits within Thomas's team, and this will now evolve into Bolder Healthier Birmingham. So linking into the kind of icon and image that you can see at the bottom left-hand side, sorry. We're on social media. So Twitter, or X as it's known, you can follow us on Healthy Brum, Instagram, Facebook as well. We do, especially during winter, we do webinars, Bolder Healthy winter webinars. We did a recent one on behaviour change, vaccine, etc. So it's really, really helpful just to kind of soak that up. So any questions? Thomas has left, so what I will do is I've seen some questions come up through the chat, so bear with me. So is it mandatory to have a psychology degree? So in terms of these person specification, what we say is a degree of relevant equivalent level qualification. So if in your degree, I would suggest if there's any way that you've done, behaviour change or made, any work that you've been involved in, do make reference to that. It isn't mandatory as such, it just as long as you have a relevant degree. So if you, from a sociology background, for example, and you've done behaviour change, that you can apply. So what I would suggest is just make sure that your person specification in your statement, is really clear about where the public health kind of behaviour change element has come through. Okay, great. Well, thank you so much for attending this afternoon. As I said, the deadline has been extended to this Sunday. Please do refer back to what we've said. I can see some people typing, and this recording will be available at the end, and we'll get our comms colleagues to pop it onto our YouTube channel. But yeah, good luck. If you are applying, good luck. And I hope you've had a really good session. And just thank you so much we're just overwhelmed by the amount of interest that we've had on this, on the call as well. So thank you for all your questions as well. My email address is on the advert. So if you have got any questions, any queries, you just want to clarify something that I probably didn't explain very well, please just drop us an email, drop me an email and I can respond to you. But like I said, thank you so much. And if no one's got any questions, I'm just going to stop the recording and let you all get a few minutes back of your time.